welcome to the deep dive. Think of this as your essential health bulletin, cutting through the noise to get you the intel that really matters.
We're digging into some recent reports, pulling out the key developments.
Exactly. Our mission today is to give you a quick, thorough look at some, well, frankly, surprising health stories, from familiar viruses acting in new ways to ancient threats getting a modern response.
And some major breakthroughs, too.
Right. We want you to be truly well-informed on things you might have otherwise missed. Okay, so first up, let's unpack the COVID situation. Sources are definitely showing, well, the start of a summer wave.
Seems that way. Cases rising in about half the states.
Yeah, 25 states, especially seeing bumps in the south, southeast, and out west. And while the CDC wastewater data still says low overall for the nation, it has ticked up from very low just last week.
And ER visits are climbing in some places, too.
So what's the CDC saying? Is this just another wave, or is there a pattern emerging here?
Well, that's what's quite interesting. Their analysis suggests COVID is kind of settling into a predictable biannual pattern now.
Biannual. So twice a year.
Exactly. We're seeing these peaks pretty consistently, it seems, in late summer, July through September, and then again in the winter, maybe December to February.
Huh.
And they think it's linked to how the virus keeps changing. Specifically its spike protein, what they call S1 diversity.
So it's evolving in a way that creates these regular surges, almost like the flu season, but twice.
Sort of, yeah. It gives us a bit more predictability, which helps with planning.
Okay, and it's not just COVID making noise. Our deep dive also flagged a CDC warning about parvovirus B19.
Ah, yes, that's been spreading more than usual.
Most people don't get too sick, I gather.
Generally, no, but it is a higher risk for pregnant women, potential complications there. So the advice is extra precautions, maybe masking in crowded indoor places if you're pregnant.
Right. And importantly, this isn't the one dogs get, correct?
Absolutely not. Totally separate virus, strictly human. Chicago's actually seen a spike in ER visits for it, levels they haven't seen since, 2015?
Wow, okay. So something to be aware of. But then, shifting gears completely, our research dug up something, well, pretty startling, an ancient threat reappearing.
You mean the pneumonic plague case?
Yeah, in northern Arizona, a human death, which is incredibly rare, right? First one in that county since 2007.
It is very rare these days, but the bacterium Yersinia pestis, that's the agent that caused the Black Death.
The actual Black Death.
The very same. And it's still classified as a tier 1 biothreat agent. That's, top-level concern.
Because it's so dangerous.
Extremely, yes. Especially the pneumonic form, which affects the lungs. It can spread person to person through coughing or sneezing. And if it's not treated really quickly with antibiotics, it can be fatal in just a couple of days.
That's terrifying. Oh. But there's also some incredible news on this front.
There is, remarkably. Scientists over in Tel Aviv have developed the world's first mRNA vaccine specifically for pneumonic plague.
An mRNA vaccine, like the COVID ones, for plague.
Exactly like that. And in the animal trials, the results were, well, staggering. 100% effectiveness.
100%. That's amazing. So this mRNA technology, it's proving really adaptable then.
It really is. It shows the potential to pivot this tech from, a global viral pandemic to an ancient bacterial biothreat. It offers a powerful new tool, especially with worries about antibiotic resistance growing.
A completely new line of defense. And speaking of breakthroughs and new tools, our dive also highlighted a big step in HIV prevention.
Ah, the new WHO recommendation, lenacapavir.
Right. An injectable, long-acting option only needs to be taken twice a year.
Just twice a year. And that is genuinely transformative. Think about it compared to taking a pill every single day.
Huge difference for adherence, I imagine.
Massive. For anyone who faces challenges with daily pills, maybe because of routine or stigma or just accessing healthcare regularly, this removes huge barriers. It's about giving people more control, more options.
And it's still badly needed, right? HIV hasn't gone away.
Not at all. There were still 1.3 million new infections globally in 2024. So expanding choices like this, making prevention easier and more effective, it's absolutely crucial. It empowers people.
So quite a range there. We've touched on ongoing viral waves, finding new rhythms, ancient diseases meeting very modern science, and major strides in global prevention efforts.
A lot happening beneath the surface.
Definitely. And that's really the point of the deep dive, getting you informed on these significant shifts quickly and thoroughly.
So for you listening in, what stands out?
Yeah, maybe consider how these stories, seemingly quite different, actually connect. They really underscore how dynamic medicine and public health are, this constant evolution of threats, but also, crucially, innovation.
And the need for ongoing vigilance.
Absolutely. Constant vigilance and innovation.